Trichotilomania is a disorder that involves recurrent, irresistible urges to pull out your hair from your scalp, eyebrows, or other areas of your body despite trying to stop. Hair pulling from the scalp often leaves patchy bald spots, which causes significant distress and can interfere with social or work functioning. People with trichotilomania may go to great lengths to disguise the loss of hair. Excoriation. Many people pick at their skin once in a while, but sometimes it crosses the line into a condition called skin picking disorder. When this happens, picking at the skin, for example, picking a scalp or the skin around your nails, can become so frequent and intense that it causes bleeding, sores, and scars. Hoarding disorder is a persistent difficulty discarding or parting with possessions because of a perceived need to save them. A person with hoarding disorder experiences distress at the thought of getting rid of the items. Excessive accumulation of items, regardless of actual value, occurs. Hoarding often creates such cramped living conditions that homes may be filled to capacity with only narrow pathways winding through stacks of clutter. Some people also collect animals, keeping dozens or hundreds of pets in unsanitary conditions because they cannot care for them properly.
What does it mean, trichotilomania? Trichotilomania is some sort of impulse control, and it means that the patient started to hair pulling the hair of head or the hair of eyes or the hair of other body's area. In different condition and in chronic and severe condition, the patient started to make a severe and strong hair pulling without even know that he do this behavior. And this is very significant pattern we can note it in patient who suffering from obsessive compulsive disorder. And when you ask the patient why you do this behavior, he definitely say to you that this behavior relieve my anxiety and reduce my feeling of anxiety and reducing my feel of tension, till the point that turning to habituation and started to be habit. So it's removed from trichotilomania, hair pulling, and as a disorder, and started to be as a habit, behavioral habit, like his personality traits. And then with several situations, he feel anxious, he feel distress, started to make hair pulling from his hair of head. One of patient started to make this hair pulling on front of his head, and another one from beside, and another one from backward.
Trichotilomania is pulling out of hair. It is a compulsive urge to pull out one's own hair and leads to loss of hair and leads to distress and impairment in social or functional impairment. Trichotilomania may present in infant, but the peak age of onset is 9 to 13. It may be triggered by depression or stress.
Now, we spoke about trichotilomania and excoriation. We find that they are part of the impulse control disorders, but can be viewed separately. To diagnose trichotilomania, we find that the individual has a difficulty to control his impulse to pull out their hair. And it is usually time consuming, and the patient has a sense of relief after the pulling of the hair, followed immediately by the another impulse problem and an anxiety to again and repeat the hair pulling, and it's called, the term is trichotilomania. And of course, it interferes with the individual's function and lifestyle, and is very time consuming and distressing. As for excoriation, it is similar to trichotilomania. However, it involves the impulse to pick one's own skin off, and it also can be repetitive and time-consuming and can lead to a functional impairment.
It's much important to know that the pain doesn't accompany with hair pulling because patient doesn't care about the pain, and perhaps he didn't feel any pain when he do the hair pulling. About the percentage, in the general population, we can find that during the 12 months or the 1 year from the first complaint, we can find that about 1 to 2% of adolescents started to suffering from trichotilomania.
The peak age of trichotilomania in infant is 9 to 13 years old, and prevalence rated from 1.5 to 30.4, and more common in female than male, and more common socio-economic standard, low socio-economic standard, and this disorder leads to social and distress social impairment.
Trichotilomania with a very significant and main diagnostic criteria, which related to recurrent pulling out of one's hair resulting in hair loss, repeated attempts to stop or to decrease hair pulling. Trichotilomania has to not included any medical condition or any organic factors. Another important thing related to the trichotilomania that it's related to an anxiety disorder, and an anxiety disorder may pushing the individual to hair pulling to relieve or to reduce this pattern of anxiety.
Trichotilomania is defined as recurrent and stereotypical pulling of hair, usually after stress, and such condition also can be diagnosed when the client is in rest, for example, when clients are watching TV or involved in certain relaxing activities. There could be recurrent pulling of hair. Such pulling of hair usually involve the scalp, but other areas such as the eyelashes, the eyebrows could be affected by such kind of condition. Usually it's disturbing. The clients usually refer to our clinics because of the significant loss of hair, which cause a certain deal of anxiety or sometimes depression.
the causes of trichotilomania and hoarding disorder. It's not clear what causes all of these, but all may result from a combination of causes such as brain differences, genes, environment. Skin picking disorder often develops in one of two ways. After some kind of rash, skin infection or small injury, you may pick at the scab or rash, which causes more injury to the skin and keeps the wound from healing. During a time of stress, you may be absently pick at the scab or the skin around your nails and find that the repetitive actions helps to relieve stress. It then becomes a habit.
The impulse control disorders like trichotilomania and the excoriation and even hoarding disorders can be associated with other psychiatric disorders and are comorbid commonly with certain psychiatric conditions like, for example, depression. Many of the patients with trichotilomania later on develop depressive symptoms and might have a major depressive disorder. Other comorbidities can include an anxiety disorder like generalized anxiety disorder and sometimes maybe a panic disorder.
For the comorbidity, depression, generalized anxiety disorder, obsessive compulsive disorder should be always ruled out when we speak about trichotilomania.
Signs and symptoms of trichotilomania often include repeatedly pulling your hair out, typically from your scalp, eyebrows or eyelashes, but can be from other body areas and sites may vary over time. An increasing sense of tension before pulling or when you try to resist pulling. A sense of pleasure or relief after the hair is pulled. Shortened hair or thinned or bald areas on the scalp or other areas of your body, including sparse or missing eyelashes or eyebrows. Preference for specific types of hair rituals that accompany hair pulling or patterns of hair pulling, biting, chewing or eating pulled out hair, playing with pull out hair or rubbing it across your lips or face. Most people who have trichotilomania also will pick their skin, bite their nails or chew with their lips. Sometimes pulling hairs from pets or dolls or from materials such as clothes or blankets may be a sign. Most people with trichotilomania pull hair in private and generally try to hide the disorder from others. Hoarding disorder affects emotions, thoughts, and behavior. Signs and symptoms may include clutter and difficulty discarding things are usually the first signs and symptoms of hoarding disorder. Persistent inability to part with any possession regardless of its value. Excessive attachment to possessions including discomfort letting others touch or borrow them or distress at the idea of letting an item go. Cluttered living spaces, making areas of the home unusual for the intended purpose. Cluttered living spaces, making area of the home unusable for the intended purpose, such as not being able to cook in the kitchen or use the bathroom to bath. Keeping stocks of newspapers, magazines or junk mail. Letting food or trash build up to unusually excessive unsanitary levels. Acquiring unneeded or seemingly useless items such as trash or napkins from a restaurant. Difficulty managing daily activities because of procrastination and trouble-making decisions. Moving items from one pile to another without discarding anything. Difficulty organizing items, sometimes losing important items in the clutter. Shame or embarrassment. Limited or no social interactions.
Signs and symptoms of trichotilomania are pulling out of hair and leads to hair loss. The most common site in occurred of trichotilomania is eyelash, eyebrow, over the body, scalp, and genitalia. And trichotilomania may present in infant and but less common in infant, but more common in female, female. May lead to hair loss in scalp, leads to alopecia, maybe alopecia totalis or partialis.
The problem with trichotilomania and the excoriation is that they tend to be somewhat chronic. They continue with the patient, and the patient has difficulty controlling them. So the prognosis depends on various factors, among which is the comorbidity of other disorders and whether or not the patient will receive the proper support and the proper treatment and management. But they tend to be chronic and sometimes waxing and waning, so sometimes they might disappear for a period of time and then later on return back. So the psychiatrist and physician should put into account the prognostic factors to help tailor the management plan.
Trichotilomania may also accompanied with a various of emotions factors such as anxiety, depression, and another feeling of anger and irritability of mood. We can find that the most important thing also in the features, the supporting diagnosis, that the patient make a hair pulling out to get out the hair from its root, from his hair, and the patient suffering from a lot of disturbance in his emotions related to this way of behavior. Another important thing that the patterns of hair pulling related to hair loss, and the patient through these images started to be isolated from people around him, especially in females, by the way. We can find that the patient who suffering from trichotilomania from female genders with a very impairment in its relationship with partner, especially in the personal relationship and intimate relationship with her partner, because she found herself with impairment body figure, especially in the area with hair loss.
Very good history taking from the patient with trichotilomania. It makes the diagnosis so easy and no long list of differential diagnoses. Then, from the patient himself, he should give the full description of the feeling he is having, and as we discussed in the impulse control disorder, the patient, before pulling the hair, which is either from the head or the eyebrows or the lashes even, or sometimes from any part of the body, there is some degree of urge to do that. There is a feeling and gratification during the pulling itself, then a guilt feeling after. For that reason, if you have this triad in the hair pulling, this is a straightforward case of trichotilomania.
The trichotilomania diagnostic features, it's related to that the person may induce any scalp or pulling from any area of his body. Perhaps also the patient started to scalp or make a hair pulling of his eyebrows. And another important thing that the patient may also induce hair pulling from his hair of his head from the forward or backward. Such hair pulling may endure for months or for even years, by the way. And if the patient cannot observe that this is a disorder and the people around him didn't start to advise him that he needs a medication or need a treatment, this kind of disorder may be started to progress and started to get the patient in a very bad state.
The condition should be differentiated from factitious disorders, as well as the condition should be differentiated from obsessive compulsive disorder.
Treatment. Habit reversal training is the primary psychotherapy for trichotilomania. This type of therapy helps you learn how to recognize situations where you are likely to pull hair and how to substitute other behaviors instead. Sometimes, elements of other therapies may be blended with habit reversal training, including cognitive therapy. This therapy can help you challenge and examine distorted beliefs you may have in relation to hair pulling. Acceptance and commitment therapy. This therapy can help you learn to accept your hair pulling urges without acting on them. There are two main kinds of therapy for skin picking. Habit reversal training. The therapist helps you identify the situations, stresses, and other factors that trigger the skin picking. Then your therapist will help you find other things to do instead of skin picking, such as squeezing a rubber ball. This will help ease stress and occupy your hands. Stimulus control. This therapy involves making changes to your environment to help curb skin picking. For example, you might try wearing gloves or band-aids to help prevent feeling the skin and getting the urge to pick. Or you might cover mirrors if seeing facial blemishes or pimples brings on picking behavior. Psychotherapy, also called talk therapy, is the primary treatment for hoarding disorder. Cognitive behavioral therapy is the most common form of psychotherapy used to treat hoarding disorder. Try to find a therapist or mental health provider who has experience in treating hoarding disorder. As part of cognitive behavior therapy, you may explore why you feel compelled to hoard, learn to organize and categorize possessions to help you decide which ones to discard, improve your decision-making and coping skills, learn and practice relaxation skills, attend a family or group therapy, have periodic visits or ongoing treatment to help you keep up healthy habits. Medications. There are some medications may help control the symptoms of trichotilomania. Skin picking disorder is treated also with medications, although the primary intervention for hoarding disorder is psychotherapy. Research continues on the most effective ways to use medications in the treatment of hoarding disorder.
How the society and people in public deal with trichotilomania? By blaming the patient. This is a big mistake. We know blaming the patient is not good in all psychiatric disorders, but specifically in trichotilomania. Why? The patient trichotilomania, the third part of the disorder, as we have mentioned before, there's an urge and gratification, then a self-blame. The patient continuously blaming himself. If we blame him, we minimize the immunity of that patient to resist trichotilomania feeling. Then, when the patient have self-blame, we should minimize the self-blame, not to minimize the resistance of the patient to the trichotilomania. Then, no criticism. What to do for them? The behavioral modification following a program with our psychologist is the most important thing.
The most important CBT to treat trichotilomania: 1. It's to make a schedule. 2. Self-observation. How many times the patient with trichotilomania feel anxiety during the day, and make the severity of this anxiety, and how much the craving. Craving, it means the desire to do this behavior, to start to make my hand and fingers and started to hold the hair and started to cut it off. So that the patient have to make a self-observation during the day, how much they feel anxiety and how much they feel the craving or the desire to trichotilomania. And then to start to do relaxation, progressive, relaxation muscles progressive.